Thank you to the organisers for inviting me to speak here today. It's a great honour to speak at your first Pan-Hellenic Congress, and I have enjoyed my stay here so very much, and I wish you the best of luck with the remainder of your Congress. So I'm going to speak to you about working in Europe and the current status of the medical physics recognition in Europe. So what is the current status? Well, at the moment, medical physicists are listed in the International Standard Classification of Occupations. We aren't listed as one of the key health professionals, but we are listed under a subgroup. You probably can't see it down there, but at the very bottom of the writing there on the left-hand side, medical physicists are listed in this group recognized in group 2111. So at the moment in Europe, as a medical physicist, if you obtain your qualifications in your country and you want to move to another country to work, there's no automatic recognition of the qualifications between the member states or in any of the European Economic Area. So one of the key strategies of EFOMP is to change this. So we want to make it easier for our medical physicists to move within Europe. One of the most common queries that we get to the Professional Matters Committee is, can I work in another country? I have obtained my qualifications in Greece. I would like to go work in Cyprus, or I would like to go work in Spain. Is there a process for this to happen? And unfortunately, there isn't at the moment. So, as you were all aware, the basic safety standards, which were published in 2013, these are the key standards which are driving our professional development over the next 10 to 20 years. So in this official document, which has been implemented in each of the EU countries, they clearly state that member states should ensure that there are arrangements in place in each of the member states for the establishment of education and training and retraining for radiation protection experts and also for medical physics experts. So most European countries had a system in place for RPEs, but a lot of them didn't have a system in place for the recognition of MPE. So European countries are now working towards having a system of recognition for MPEs. So the official journal document came out in 2013, and following that, there was a working group which was established to look at the role of the medical physics expert, because it wasn't clearly defined in the directive. The directive was a great success for medical physics experts and for medical physicists, because in the previous directive we'd only been listed 3 times. In the new directive we'd been listed 9 times, and we were one of the only professions to be listed and given key duties in the directive. So most of you are probably aware of EPP.1, which was published with under the European Commission, which is the European Guidelines on the Medical Physics Expert. And there are a number of recommendations in these guidelines, but one of the key ones for the MPE is that the competent authority in each of the European countries should use the qualification frameworks and the knowledge, skills and competencies of the MP specified in EPP.1 to recognise their MPs, and that MPs should be qualified to the level 8 of the European Qualification Framework. And they also had a key recommendation that to allow the mobility of the MPs between member states, that it is recommended that the education and training of each of the MPs is recorded in a document, like a portfolio or a training document, and that can be used as a proof of the recognition of the competencies for future. So these are the qualification framework for the MPs. So the basic, the initial stage when we all go to college and we get our physics degree or degree in medical physics, you should be trained to the level of EQ level 6 or EQ level 7. And then once you obtain your basic degree in physics, then you go on to move on to the next phase, which is your clinical training to become a medical physicist. So each country has a different process. I believe in Greece you have a process where you have training for 3 years to become certified as a medical physicist, and then you have another 3 years to become an MPE. So in each country is different. So in Ireland, we only have a training scheme for radiotherapy. We don't have one at the moment for diagnostic, but our MPs have to have a minimum of 5 years of education and training post their degree before they can be certified as an MPE. So we have been encouraging, EFOMP have been encouraging each of the countries to use these qualifications, this qualification framework to set up national registration schemes for their MPs. So, as I said, the initial phase after you get your degree is usually 2 years, and then you have your advanced experience where you're trained to EQF levels 8 in your medical physics speciality. So the EPP.1 does recommend that each MP is trained in specific specialities. So they're broken into 2 or 3 different specialities. So you have diagnostic imaging and interventional radiology, nuclear medicine, and then radiation oncology. Some countries have this give the speciality for all 3, and I believe this is the situation here in Greece. So once you reach you obtain your advanced experience and you're certified as an MPE, you go to your competent authority to obtain your certificate in your speciality. But the process doesn't end there. You must keep up your CPD, and it's recommended that every 5 years you are reevaluated and by the competent authority to make sure that you're keeping up your CPD and your professional practice. So, as I mentioned, MPE mobility across Europe, it is a key objective of EFOMP and also of the EU Commission. And this is because there's a shortage of MPs in some EU countries, and this is resulting in some unqualified people taking up the role of an MP without having the necessary qualifications and training. And we know this because we did a survey, EFOMP did a survey in May 2021. So we want to prevent this issue. We want to make sure that our profession is strong, that everybody working in the profession has the correct qualifications. So we believe that the mobility for MPs across Europe will help ensure equitable access to healthcare for our patients and drive the healthcare infrastructure and sectoral growth across the European Union. There are, of course, implications for MPE recognition that need to be considered. As Paddy says, the president of EFOMP, there's things to think about. If we achieve MPE recognition across Europe, it could result in possibly an exodus, result in a loss of MPs in your country because they may want to go to another country and work there where there is better pay. So these are things that we need to think about. But we believe on a whole that it is a positive move. So is this possible? Yes, this is possible. There is a system in the EU Commission where there's an automatic recognition for professional qualifications. At the moment, it is for 7 sectoral professions, so for nurses, midwives, doctors, dentists, pharmacists. But there is a directive, 2005/36/EC, which enables the free movement of professionals across Europe and is based on having a harmonised minimum training requirements. And in order to achieve this, an application needs to be made to a division within the EU Commission called DG GROW, and they are the Director General for Internal Market Industry, Entrepreneurship and SMEs. Recognition does not mean an access to practice. So if we get the MP recognition across Europe, it doesn't mean that you can automatically go and work in another country. Well, it does, but there are some barriers. You need to be able to meet the local requirements. You need to be able, obviously, to speak the language. And some countries may have specific requirements that you need to fulfill before you can work. But if it is established across Europe, then it puts pressure on each of the EU countries within the European Economic Area to adopt. So, as I said, it's EFOMP's policy to increase the quality of physicists working in healthcare and prevent people taking on the role of the MP who are not qualified. EFOMP have been working for many years, increasing the education and training. We have established core curriculums for each of the specialities. So last year we published the core curriculum in radiation oncology. We're now updating the one in nuclear medicine, and then we'll move on to diagnostic imaging. So we know that many of the European countries have a formal mechanism for recognising the qualifications of MPEs, and we did a survey in 2019 that showed 22 of the national member organisations had established national registration schemes for MPEs. And since then, we know that more countries have set up national registration schemes. So since 2018, EFOMP have reviewed and approved 9 national registration schemes from our NMOs. And this number is very important, and I'll speak about that in a minute. And I was very delighted last year to receive an application from Greece. And as you saw on Friday, was it Friday or Saturday? Yesterday, we presented the certificate to Greece for your approval of your national registration scheme. So we have a criteria. I won't go through it in too much detail, but each of the national training or registration schemes have to have a clear statement of aims. There must be a registration council, and this must involve different groups of people to ensure that each aspect of the national registration scheme is taken care of. There has to be clear criteria of the knowledge, skills and practical competencies. The training schemes or the system that you're using to review your MPs should be based on EPP.1, and you should have defined speciality areas, and then you should have a CPT scheme and a system for professional dealing with professional misconduct if it was to arise. So, as I said, we have 9 countries approved. Greece was the number 6, I think, and the process works. It's looked after by my committee, and each application is reviewed. It's a 6 to 8 week process. Sometimes it takes longer. Sometimes we go back to the country and say we need some extra information, and a report is prepared by the chair of the committee, which is myself at the moment, for the EFOMP board. It is then reviewed, and the board makes the final decision. And usually there are, each criteria is evaluated, but we will look at each criteria and decide if you meet each criteria. If you don't meet each criteria, we will make some recommendations. The key criteria have to be met for approval, but if there are some issues over maybe your CPT scheme or maybe you don't have guidelines for professional misconduct, we will give recommendations and we will reevaluate your scheme in 10 years. And we will expect, sometimes we give a shorter time frame, we say we want to see this done in 5 years, but the approval does last for 10 years. So this year we reached the magic number of 9 NRSs, and the number 9 is important because once you reach the situation where you have common training framework in 1/3 of the member states, you are in a position to make an application then to the EU Commission for MPE recognition under this common training framework that they have. So they have this framework where if you have the common training across across the member states, and you have agreement with the member states on the knowledge, skills and competencies, you can apply for recognition of your profession. So the reason we've chosen medical physics experts is because there is a really clearly defined system for medical physics experts in EPP.1. It would be much more difficult to obtain recognition of the title medical physicist because each country has a different system for giving the certificate for medical physicist. So we are applying under the Common Training Framework, and this is based on the European Qualifications Framework. And I'll just give you an overview of the process. So the process is that a representative professional organisation at union level or at national or professional organisations can apply to the EU Commission. So that is what EFOMP plans to do. We have already spoken to the DG GROW. We have had some communications with them. We had a member of their office speak to us at ECMP in Dublin to explain the process for the Common Training Framework. So the hardest part with dealing with the EU Commission is getting to meet the right people. We've already got to meet the right people. So we feel that we are in a good position now, and we have had a lot of discussions with our colleagues. We have some colleagues in Ireland who obtained this right for the title radiation therapists, so we know the process. So once we make the application, DG GROW check if the conditions are filled for the application, and their key focus is on mobility aspects. So they want us to show to them that there is an issue with the availability of MPs across Europe. So this is our next phase of our process. And then they the DG GROW prepare this delegated act, and they get all the member states into the room, their representatives, and they discuss the Common Training Framework. Every member state has to agree to adopt the Common Training Framework. So we may get into a situation where EFOMP are asking our NMOs to find these people who are going to be sitting around the table and ask them to get involved in the process. So once this is agreed, the DG GROW and the EU Commission will then list the national qualifications and the professional titles which will be associated with this Common Training Framework in a implementing act. So that's kind of the overview of how it works in the EU Commission. So we are aware that establishing a common training framework is a long-term process. It is based on mutual trust between the EU member states and the educational institutions, and we know that we have been warned that it does take a long time, but we do feel that we have the support of DG GROW and also of the group involved with ionizing radiation in the EU Commission. So there is a lot of work underway between the EFOMP Professional Matters Committee and the European Matters to prepare the application. We're meeting hopefully in Brussels in March to work on it, and we're preparing the initial application, and we're having a meeting next week to establish how are we going to establish that there is an issue with mobility in Europe. So in summary, EFOMP believes that achieving automatic recognition for MPEs will benefit our patients and our profession, and the EFOMP motto is applying physics to healthcare for the benefit of patients, staff and public, and we believe this key objective will help achieve this. Okay, thank you.
Thank you, Brenda. I think μπορούμε να κάνουμε τώρα, νομίζω, μερικές ερωτήσεις, γιατί μετά ίσως δεν καταλαβαίνει η Brenda. Αν υπάρχει από το ακριτήριο κάποια ερώτηση, κάποιο σχόλιο. So, do you have any medical physicists who work in hospitals or in private section from other countries in Dublin?
Yes, we do. We have some from the Netherlands. We have some from Spain. We have some from Greece. Yeah. Our country welcome all medical physicists. We don't have strict conditions in Ireland for medical physics as long as you're coming to work in Ireland. But the problem is we've had physicists from Spain who have trained in Ireland, who have gone back to their country, and then their qualifications aren't recognised. Their training is not recognised. So Ireland, we welcome all medical physicists. If you can speak the language, you're welcome to come. And we were discussing last night, we get very well paid in Ireland. But the problem is other countries, when our physicists train, so we have an Irish girl who is trained, who has done all her training. She is an MPE. She wants to work in Spain, but she can't because they will not recognise her training and her qualifications.
So it's not very difficult. There is a legislation. If they cover whatever you need in Dublin, they can find a job.
As long as you, in Ireland, to work as a medical physicist, if you meet the minimum training as a medical physicist, you can work as long as you have a degree in physics and some training in medical physics. But to become a medical physics expert, you do have to meet the criteria like EPP.1. So you have to make an application. But if you can prove that you have done your training in another country that maybe has a national registration scheme. So with the national registration schemes for EFOMP, if you are working in a country with an approved national registration scheme, you can automatically come to Ireland and be recognised as an MPE.